bit of a different approach in what I'm going to talk about. I come from a safety and quality organisation, not from a public health or a communication organisation. So this is a bit of a different take and probably a complementary perspective on health literacy and how we're starting to think about it, starting to tackle it in Australia. Just to give you a bit of background, the organisation I work for is the Australian Commission on Safety and Quality in Healthcare, which is a national leader around, national government-funded body, leads and coordinates safety and quality nationally. We have quite a broad remit across the whole health sector, public and private, acute and primary care settings. And we're quite a small organisation, we're about 40 people, so really the way we do our work is through consultation, collaboration, dialogue, discussion. Our main areas of work to date have been around national standards, and I'll talk a bit about that later, and accreditation. That's been something we've been doing since we were established. We have a large role around data and indicators, development of data indicators, particularly in the area of safety and quality. And then the process is about reporting and publishing and about knowledge and leadership, that kind of role. So what I'd like to do firstly is really to describe how we are looking to build health literacy into our national approach around safety and quality. And the first part of that is Australian Safety and Quality Framework for Healthcare, which was something that the Commission developed in 2010 and endorsed by health ministers in Australia. And it has three components, as you can see. The vision for safe and high quality care in Australia, that is consumer-centred, driven by information and organised for safety. And underneath that, there are a number of actions that have been identified for the health systems and a number of attributes of what that means for people, consumers and patients within the health system. And you can see the square that I've put around. This is only one part of the actions, only the ones to do with the consumer-centred angle. We have included health literacy in there. So how can we, making sure that people have the information they can understand, be able to involve in their healthcare, improving safety in that way, and increasing health literacy as a part of that. Underneath the framework, it really sets out the overall vision for what safe and high quality care looks like in Australia. And underneath that is some work that we've done over the last 12 months or so, describing a set of safety and quality goals for healthcare. Now, what these goals are really trying to identify the specific areas of work. The framework sets out the vision, whereas what we're trying to do with the goals to say, okay, if we're going to be doing safety and quality work, what are the areas that we really should be working in? Where should we be focusing our efforts? What are the areas over the next 5 years or so that would be amenable to national action? And so we've gone through a large process to get to this point. These goals have been endorsed by health ministers just last month. So there are three goals, high-level goals, one around safety of care that has underneath it a number of priority areas in the areas around medication safety, healthcare associated infection, and recognising and responding to deteriorating patients in hospital. The second goal is about appropriateness of care, and underneath that, making sure that people receive appropriate evidence-based care, because we know that there is often a big gap between the evidence and the practice. And within that, there are two priority areas around stroke and around acute coronary syndrome, as areas where there's burden on the system and good evidence. But I get the reason that I'm talking to you about this is actually the third goal, which is about partnering with consumers. And what this goal is talking about is that there are effective partnerships between patients, consumers, healthcare providers and organisations at all levels of healthcare provision, including planning and evaluation. And what we've done within that, we know that the partnership is necessary for improvement in all areas of safety and quality, but really felt that it was so important and in such need of development, it needed to be raised to be the level of a goal. Within each of these goals and the priority areas, we've identified a number of outcomes, a number of areas that we're suggesting we really want to see change over the 5 years. And these are the ones for the partnering with consumers goal. Focusing here about chronic disease self-management, particularly so management of their own conditions, self-management, particularly second one is about communication, so patient-provider communication. The third one, really picking up on the work that's been done here at the IOM about attributes of a health literate organisation and see if we can move our organisations to becoming more health literate. And the final one being about involving consumers in a meaningful way in governance of health organisations. So really covering the spectrum from partnerships that exist within when people are receiving care between the patient and their provider, but also partnerships that can exist at an organisational level and everywhere in between. So it's quite an ambitious goal. I don't know how far we'll get in 5 years, but nonetheless we felt that we needed to identify these things. And what we've done then also is, within each one of those outcomes, is to develop what we're calling action guides and trying to identify what are the actions that need to be taken across the whole health system. So if we're in 5 years' time, we're looking at this and we're saying, where would we want to be? What would we be saying, this is great that we've achieved this? What would success look like? How do we know when we get there? Very difficult in this area because there's the measures and the sort of thinking about evaluation needs more work. But then what are the actions that can be taken, not just by governments and within the health system, but actions that can be taken by patients and carers, actions that can be taken by providers, by health services, hospitals, and the Commission as well. We've also, I couldn't fit, it's already crammed in, there are people that I couldn't fit on that slide in terms of research organisations, universities, training organisations, non-government organisations. So we've tried to identify actions that can be taken across the board around achieving these goals. So the final, the final part, and probably at the moment one of the most important parts of this sort of national approach to safety and quality that we're looking at how we can build health literacy into, is some work that's going on about national safety and quality standards. So that logo stands for National Health Service, National Safety and Quality Health Service Standards. Way too many letters all over the place here, but that's what that one stands for. So accreditation and accreditation reform has been a core part of our work since the Commission was established in 2006. And there are really two parts to this work. The first is the development of this set of safety and quality standards. And the second part is our role as coordinating accreditation nationally. Accreditation is something that's been going on in Australia for a long time. Most hospitals are accredited, but there has never been a consistent set of safety and quality standards that have been mandatory across the board for all hospitals and day procedure services, which is what's going to be happening now from the beginning of next year. And so what we're really trying to do with these standards is to move away from a perception of accreditation as a tick box checklist process to really thinking about using these standards as the basis for quality improvement. So an ongoing cycle of quality improvement where the standards provide the focus for action. We haven't included health literacy as such within these standards, and the standards themselves cover a whole range of different areas. There are two standards that are overarching standards across the board, one about governance for safety and quality and one about partnering with consumers. And then the other 8 standards cover what you would expect from a sort of patient safety perspective in terms of things like healthcare associated infection, medication safety, clinical handover or handoff, patient identification, use of blood and blood products, pressure ulcers, falls and deteriorating patient. There are a number of items around information for consumers, around consulting people, around the type of information and how it's developed. And we think, so the 2.4 and 2.5 from the partnering with consumers standard, and then 4.15, and there are similar ones in all of the other ones, about providing information in a way that can be understood, and in a format that can be understood. Now, it's not ideal, it's not the best that it could be, but it's a starting point, and these things are going to be mandatory, and it will be very interesting to see how hospitals go in terms of meeting these criteria and standards. So this is the framework for the national policy framework, and I wish I could say that I knew how that was going to go and that it was all in place and all happening. The that's not the case at all. A lot of this stuff is really quite high level, and we haven't got there yet, and we haven't yet started. People are putting standards in place, but we really haven't worked through the process of how it's going to be. I do have some information about things that are happening, and it's interesting how Canada and Australia, in so many ways, are doing similar things. So we've done, over the last 6 months, really earlier this year, what we call stock take, a national health literacy stock take. It was not a systematic process, as it was not a comprehensive process, and some of the information in it informed Andrew's paper, which was a great opportunity that we were able to do that. So I just wanted to give you a bit of a quick view that we weren't actually able to put in, because we hadn't done it yet when Andrew was collecting his information. So this was between December and March this year, and we put out an invitation quite widely. We didn't have the capacity or resources to go out and actually comprehensively collect information, so it really depended on what people gave to us. We had 66 submissions describing over 200 different initiatives, and we really found a whole lot of stuff going on, a whole lot of different organisations doing a whole lot of different things, and a range of different approaches that were being taken. And I'll just talk briefly about that in a second. But I guess one of the overarching things, and similar to what Sandra was saying, things are quite fragmented, and there's pockets of bits and pieces going on in various places, but really few opportunities for learning and sharing of information. And certainly, whenever we've talked about health literacy, the response has been very positive. People have wanted some national coordination, and hopefully we're going to be able to do that. So just quickly, this is the results of what we found with the different types of initiatives. That we had initially thought that we might be able to classify these according to, whether it was about print literacy or whether it was about, critical literacy or some kind of a theoretical frameworks, and that was not the case. What we really found was these are the type of work that people are doing to improve health literacy. And you can see here, I'll give you some brief examples. So in terms of the policy and framework stuff, this was sort of, for example, a state government that had a policy, one of the few state governments in Australia that actually had a health literacy policy. Most of the information we received was about health information, so where people had developed things, resources about topics that they had either worked with the target group or experts on. So, for example, things like fact sheets for people with disabilities, things like radio campaigns for different ethnic groups. Lots of that was the most common by far. There were a number of projects that were looking at improvement of skills. So there was a project around working with people who had a chronic illness to develop up their self-management capacities, that kind of thing. Went into the green one about improvement of health literacy skills. People were starting to look at projects that were looking at the environment. So what the health literacy environment was, for example, in a hospital. There were only a few projects. There were some projects of doing workforce training, so training, building capacity, understanding about health literacy. And then there are quite a few quite a lot of researchers in Australia about health literacy, and we see quite a bit of information about work they were doing in terms of things like measurement of health literacy, evaluation and decision support tools, effectiveness of information resources, all the kinds of things that were going on here. So and it's very useful information, the sort of information that we didn't have before. I guess where to next for us, where I feel like we've been talking about health literacy for a while, and we now need to start to really bring it together. So it will continue, I think, that the focus on health literacy as a fundamental part of safety and quality is only going to increase. In the 5 years I've been working at the Safety and Quality Commission, it has increased enormously, and there's really quite a momentum around there. The standards, the safety and quality standards, are going to be a huge driver in Australia over the next couple of years, and we need to look at how we can build health literacy into that. We really want to start work now, and for me it's a great opportunity to be here in this, and we want to start to work on a national approach, and certainly Cynthia's discussion about a national action plan, I think, is something where we would like to head. We particularly want to focus on the aspect of what can the health services do, how can we reduce the barriers around health literacy as our main area of focus would be more likely than the more public health approach that some other people here might be taking. So my email